Today we're going to be speaking about sickle cell anemia. What is sickle cell anemia? Sickle cell anemia is caused by a change in the genes that tells the body to make iron-rich compounds in red blood cells called hemoglobin. Hemoglobin actually enables the red blood cells to carry oxygen from the lungs throughout the body. The hemoglobin associated with sickle cell anemia causes the red blood cells to become rigid, sticky, and misshapen. For a child to be affected, it actually means both the mother and the father must actually carry one copy of the sickle cell gene, also known as the sickle cell trait. And both of them would actually pass copies of this altered form to the child. What are the complications? Sickle cell anemia can actually lead to a host of complications, including stroke. Signs of stroke might include seizures, weakness, numbness of the arms and legs, sudden speech difficulties, and loss of consciousness. Another is acute chest syndrome. Acute chest syndrome, which actually results in chest pains, in fever, and difficulty breathing. Another is what is referred to as pulmonary hypertension, in which people with sickle cell anemia have or experiences high blood pressure in their lungs. These complications is usually common in adults and actually they exhibit themselves as shortness of breath, fatigue, and also some other symptoms. And another is organ damage. Organ damage is common in sickle cell anemia, and also this is basically due to chronically low oxygen. Okay, so due to chronically low oxygen, which are deficient in the nerve and organs, they can actually damage, the kidneys, the liver, the spleen, and this could be disastrous. Okay, another is the enlargement of spleen and belly pain. A large number of sickle cell patients can actually have sickle cell get trapped in the spleen, causing the spleen to enlarge and possibly causing lots of belly pain, especially on the left side of the body. So parents of children with sickle cell anemia should learn to regularly feel their child's spleen for enlargement. Another is blindness. Blindness can result from sickle cell due to the fact that these sickle cells can actually block some tiny blood vessels that supplies the eyes. So over time, this complication builds up, and this can lead to blindness. Another is leg ulcer. Leg ulceration can actually result from sickle cell, especially this can lead to open sores or wounds in the legs. Another is priapism, which is a condition that is associated with painful, long-lasting erection due to the fact that this sickle cell can actually block the blood vessels in the penis. Another condition is DVT, deep venous thrombosis. Sickling of the red blood cells can also cause blood clots. And also another is complications during pregnancy. Sickle cell anemia can actually increase the risk of high blood pressure and blood clot during pregnancy. And also this can also increase the risk of miscarriage and premature birth and low birth weight babies. Another thing is that in adults, a blood sample can be drawn from the vein in the arm, and also in young children and babies, the blood sample is for diagnosis is usually collected from the finger or heels, of the foot. The sample is then sent to the laboratory where the samples are screened for sickle cell form of hemoglobin. If you and your child carry this sickle cell gene, you would most likely be referred to a genetic counselor by your primary care physician. Okay, so what are the treatments? What are the management? Management of sickle cell anemia is usually aimed or targeted at avoiding painful episodes, and which helps relieve symptoms and prevent complication. So treatment might include medications and also blood transfusions. And also for some children and teenagers, stem cell transplantation might help alleviate or cure the disease. I hope we are able to learn one or two things from this presentation. If you have question, you can actually ask your provider, and make sure that you pay attention to all of the signs and symptoms and seek proper medical care.